Every 10 minutes, a person is added to the transplant waiting list. By the end of this speech, 6 people will be added. By the end of tomorrow, 144 people will be added. There are too many misconceptions when it comes to organ donations, and the demand is way below the actual supply. So the result, people are dying. What would happen to those patients who end up waiting a year or two for an organ? Well, some do get the transplant, but unfortunately some end up dying on the waiting list. So what is the organ donor crisis? Well, according to Dr. Ahmed Ghazi 2016 article, an analysis of organ donation policy in the U.S., there is currently an organ donor crisis in America. Although continuing advances in transplant technology have made it possible for many people to benefit from transplant, a number of organs have continued to stay insufficient. According to United Network Organ Sharing, last year there was over 113,000 patients on the transplant waiting list and only 36,500 transplants. 36,500 may sound great, but that means 2/3 of those on the waiting list don't receive a transplant. Which brings me to my second issue. What happens to the remaining 2/3 of those people who do not receive an organ? Well, Dr. George Albuna, in 2008 article, Organ Shortage Crisis Problems and Possible Solutions, states that the high number of people on the waiting list also means that there's a high number of people dying while waiting on an organ. So the remainder of those people who don't receive organs is 2/3. According to the organdonor.gov, an estimated 20 people die every day waiting for an organ. This can be due to over the waiting time, their disease progresses, their health declines, and making some unfit for transplant surgery, and even worse, resulting in death. Some can only wait so long until their disease gets too bad and they unfortunately die. Statistics have shown that the waiting list for the organs only increase over time, which means that 20 people who die each day for waiting might increase, but that doesn't have to be the case. Problem number 3. There are too many obstacles when it comes to being accepted to the organ transplant. For instance, by some miracle you get accepted pretty quickly to receive an organ. You're still not guaranteed the surgery. There's required post-operation requirements that need to be met in order for you to receive the surgery. For instance, having a caregiver after the surgery, living close to a transplant facility, and having a stable mental health for more than 3 years combined. This is just not possible for some people. Some individuals live by themselves, don't have loved ones or people in their lives that can take care of them on a daily basis. It's required in order to receive a transplant. Some people don't have the funds to live close to a hospital that has a organ transplant center. As a result, they're not qualified to receive the organ, even though they are qualified or up next in line to receive the organ. According to the organdonor.gov, you can save up to 8 lives to becoming an organ donor. That means 8 people taken out the waiting list and 8 people given a second chance. Less people on the waiting list means less people dying while waiting for an organ. There wouldn't be an organ shortage if an unnecessary amount of deaths due to lack of organs. Now I know some people might say organ donation is bad because in case your life is in danger, they won't try reviving you or saving your life because they want to harvest your organs. That's just completely false. When you are sick or injured and admitted to hospital, the one and only priority is to save your life. Donation doesn't become a possibility until all life-saving methods have failed and the donor is considered brain dead. So when you decide to become a organ donor, the myths I've mentioned are completely false. Doctors become doctors because they want to save your lives, not take your organs. Now imagine if you call your mom, dad in need of a healthy organ, your parent has been on disability for a while, you can't provide for your family much longer, they need that transplant or to survive, support for your family. Thankfully, for most of us, this isn't reality, but for 113,000 people on the waiting list, those on the waiting list are all mothers, or all fathers, or all sisters or brothers. There are somebody's loved ones trying to survive, and without the help of organ donors, they wouldn't be able to. Now you might think the only way to become an organ donor is by going to the DMV, but no one wants to wait 2, 3, 4, 5 hours just to get that red circle on your ID. You can easily go to donatelife.net, sign up, answer a couple simple questions, put your information, and honestly, it only takes a couple minutes. While this may not be a problem for most of us, we all know somebody who had disease, who needed some kind of help medically. If an organ is ever needed, it would be a shame for them to die just waiting for the day they can have that life-saving operation. So the more people sign up to be organ donor, the more lives can be saved, and more moms, fathers, sons, daughters, and people we care about don't need to die necessarily just waiting for that one organ.